Okay, it's 3 o'clock on the dot. So let's get started for today's webinar. So the topic for today is preconception care. And I guess before we go into that, for anyone that doesn't know me, my name is Dr. Alyssa Cooper. I am one of the naturopathic doctors here at Living Wellness Medical Center. I specialize primarily in women's health. I am personally interested in fertility, preconception care, and that whole life spectrum, pediatrics from that. And so I really wanted to do this webinar today because this is something that I'm talking about every day with my patients. And I also wanted it to be a resource for some of my patients. If we only had a few minutes to talk about this, that I can send them to this video to watch that has 30 minutes of the information that I might try to cram into a 5-minute discussion at the end of a visit after we've reviewed someone's labs. So that is the topic for today, and let's go ahead and get started. So what is preconception care? Preconception care is individualized healthcare that's provided prior to pregnancy, so during someone's reproductive years, with the goal to improve the health of yourself and then also the future health of your child. So it's really aiming to get you in your best and most optimal shape before you try to conceive. And another question that I commonly get is, when should you and your partner start considering preconception care? And ideally, at least 3 months prior to trying to conceive. So not starting to conceive and then considering it, but really going proactively 3 months prior to even trying. And the reason why we say that is because it takes about 3 months, around 100 days, for both egg and sperm to go through their full maturation process. So the changes that you make now are going to impact the egg and the sperm that your body has matured in 3 months. So that's why it's important to not look at this time as the only thing that's important is the month of trying. It's really, again, that 3 months prior. And I like to say 6 months plus would be ideal, because if there are any things that we need to correct or work on during that time, that gives us ample time to fix some of those issues. So if you have a lot of gut symptoms going on, or you have an autoimmune condition that we're trying to control a little bit better before conceiving, that gives us some more time to work on those things and get you feeling your total best before, again, conceiving and being pregnant. So that's the timeline to consider. And I liked this picture because I really look at this preconception time as a time to nourish your soil. So how can we get the soil of your body in its most nutrient-dense, abundant, stable place before, again, bringing more life into this world? So this is a time to focus on potentially some nutrient deficiencies, to focus on some depletions. If your adrenals are having a hard time, if you've had, a stressful past few years, or if you're currently under a lot of stress, what can we do to really nourish yourself? So then you're able to grow and nourish and create more life in the future. So I just thought that that was a nice photo to start with. And then these are the major topics to consider and topics that we'll talk about today. So the first one is nutrition and blood sugar balancing. This one is so important. That's why it is listed first. This is really the foundation to everything. So I always say you can't out-supplement a bad diet. We want to focus in on how are we getting those healing nutrients in first, and how can we support you from a nutritional level before potentially having to make some corrections of some micronutrients or some nutrients. And within this is blood sugar balancing. So it's not just necessarily getting in the nutrition, but getting it in a way that is going to stabilize your blood sugar and prevents the roller coaster of that blood sugar process, of those highs and then those lows. The next topic is hormonal harmony. So are you having regular cycles? Do you know when you're ovulating? Are you able to time intercourse to your fertile window instead of going into it unaware and just potentially not using protection, but not really knowing when you're the most fertile? So that's something that we'll talk about. Environmental health. This is so important to reduce your environmental toxins. There are so many toxins out there in the environment, and I don't want this to scare you. I really want it to just be knowledge to empower you to potentially make some changes if you haven't made those changes already. Stress is huge. We'll talk about stress. We'll talk about sleep. And then we'll go a little bit into laboratory testing and supplementation. These things are pretty individualized and unique from patient to patient. So I won't go into too much depth on the specifics of the labs and supplements, but I'll talk about general ones that I like to run. But just know that everyone is different. So some people might have more and some people might have less tested. So nutrition. All right. So this one again is crucial. So we want to eat in a way that's going to balance our blood sugar and support our hormones. So starting off, I mean, really it's looking at your plate and making sure that you have a good balance of food on the plate. So you always want to have a good protein source with a meal. You want to have a healthy fat source. You want to have some starchy carbohydrates, and then lots and lots of non-starchy vegetables. So I always tell people, aim for at least half of your plate to be vegetables, and then where is your protein, where is your fat, and where are your carbs. The main thing that we want to avoid is having a meal that's primarily carbohydrates, because if we have a meal, let's say pasta, I'm Italian, I grew up on lots of pasta dinners where it was just some spaghetti and, you know, a little sprinkling of some sauce and some ground beef in there, but potentially not really well balanced. So we want to make sure that we have that protein and fat that's going to help curb that blood sugar increase to prevent those blood sugar dips. Another key point is eating every 3 to 4 hours. So this is something that I really try to instill in all of my patients, is the importance of not skipping meals. So not skipping breakfast, not skipping lunch, not skipping dinner. Intermittent fasting, I know a lot of people are really interested in. A lot of the studies on intermittent fasting have been done on men. So generally, I don't really like my women of reproductive age to be intermittent fasting unless it's more so the end of the day where you're cutting down that eating window and not waking up and not eating a single thing until noon. Because a lot of times people are still having coffee. We really don't want you having coffee on an empty stomach. So coffee on an empty stomach is just adding fuel to your already increasing cortisol in the morning and adding in this false sense of adrenaline. And so ideally have your caffeine after you have breakfast, and really try to make breakfast the most nutrient dense meal of the day and get a lot of protein in that breakfast. So breakfast really starts the show of the day. And some things I tell people to do is try to have a savory breakfast. So switching that breakfast from traditionally what we have, which is more of like the pancakes, the cereals, the oatmeal without any protein in it, and make that a little bit more savory and have what you maybe would be having for lunch or dinner at breakfast. So that could be an easy switch. Another one, I know people love their smoothies in the morning. I am okay with smoothies in the morning if, again, you're getting enough protein in them. So if you're having a smoothie that's just some blended fruit and some oat milk or some almond milk, it's not the most well balanced. So I would add in some protein powders, some nut butters. Frozen avocado is one of my favorite things to add to a smoothie because you get some nice fat in there. It also makes it nice and creamy. So that's a little tip of just adding some frozen avocado to a smoothie, but make sure it's high in protein. You can add even some collagen peptides to that and get more protein through that. So I'm okay with smoothies again, as long as they are protein rich. And then make sure not to eat a lot of naked carbs. So what that means is that if you are having, let's say, a piece of toast, some fruit, make sure that has some protein and some fat with it. So whether that's nut butter, some hemp hearts, a hard-boiled egg with it, or a meat stick, have something together with that meal. So we're preventing that blood sugar from spiking and then crashing. Again, it's just important to stabilize the blood sugar. It's very important for the hormones. It is very important for gut health. So these are just some tips to keep in mind when we're thinking about nutrition. And then the last point is eating organic as much as you can. So there have been studies showing that pesticide use has decreased sperm counts or can impact sperm quality, or the semen analysis that are done. You can see some impacts there when there is high pesticides in the diet. So I would switch to organic food and prioritize meat and dairy because of the hormonal components of those two. So still try to get organic fruits and vegetables. But if you had to pick, because it's more expensive, then I would prioritize the meat and dairy. So these are some nutrition tips. This is a really awesome graphic that I got from a podcast that I really love. The podcast is called Your Body Has Your Back. It's two functional dietitians. They are awesome. They are a wealth of knowledge, and they made this gut and hormone healing plate. And I really love the visualization here because you can see how should I create my plates for, again, breakfast, lunch, and dinner. This is not just dinner plate. This is for every meal that you're having. So you can see on the plate on the left-hand side, we have those non-starchy vegetables making up roughly half the plate. We have some starchy carbs, we have some healthy fats, and then we have some protein. So these are all things that you want to be making sure you get in with your meals. I like the right side because it shows some examples. So you'll see in the middle for the healthy fats, they have avocado, olive oil, coconut, egg yolks. On the right side, we have protein, so fish, chicken, eggs. We have hemp hearts there. Hemp hearts are an awesome source of protein. So that's something that if you're not currently eating them, I'd look into them and see if you like them and can add them in to just spice up your meals with a little more protein. And then starchy carbohydrates on that bottom right-hand side. So rice and quinoa, sweet potatoes, beans and legumes, potatoes. So I do also want to emphasize it's important to not avoid carbohydrates. Carbohydrates are our body's preferred fuel source. So we want to make sure we're getting in enough carbohydrates. We just want them to be well balanced. So I wouldn't avoid them. I wouldn't cut them out. You're going to be very tired. Your adrenals are not going to be super happy with you. You're going to have harder time building muscle. Yes, you need protein to build muscle, but you also need carbohydrates if you are doing a very strict low carb diet. So again, unless you have a medical condition where you've been told to be low carb, I wouldn't naturally just cut out carbs because they're very important in the body. The next, so these are things to be mindful of. So the first one is alcohol intake. This one is huge. So we know that alcohol is going to cause some oxidative damage in the body, and our eggs and our sperm are particularly sensitive to oxidative damage. So most of the time when we're trying to work on egg quality and sperm quality, we're loading up the body with some antioxidants and we're trying to remove any sources of oxidative stress. So alcohol is absolutely one of those. One thing I didn't write down is smoking. Smoking is definitely something that I talk to a lot of my male patients about when they're going through fertility planning and family planning is, are you smoking? If so, can we stop? Can we potentially switch to something that's not, again, inhaled? Because smoking anything, even cannabis can really, really impact sperm quality and also egg quality. Caffeine, so this is one, I like to keep it under 200 milligrams a day. So that's roughly 2 cups of coffee a day, just to keep that caffeine level a little bit down, keep the adrenals more happy. Refined sugar, again, this is going to cause more stress and more inflammation in the body. And then processed foods. This one goes back to nutrition. And so when you're looking at a food label, can you read everything in it? Do you know what everything is? Or are there names that you have no idea what they mean? The more ingredients typically on the label, the more processed it is. And so one thing is just to focus on whole foods. And there have been studies on the Mediterranean diet and on the increased pregnancy rates when women are eating a Mediterranean diet and they're trying to conceive. So a Mediterranean diet is pretty much what we saw on the last slide. So emphasizing those good lean proteins, good fat intake, good vegetable intake. And so we've talked about that already. Next is water. So water is important. I know water is something that a lot of us tend to forget or not get enough in, especially living here in a desert. We want to make sure that we're replenishing what water we're losing and then potentially even adding, some more onto that. So we want to aim for at least half of our body weight in ounces of water and make sure it's mineral rich. That's also something that I talk to a lot of patients about, because if you have a water filtration system in your house, in your fridge, on the countertop, that is reverse osmosis, or that removes a lot, it also is likely removing the minerals, and we want to make sure that we get those minerals back in. So that's something to look into, is if you do have a water filtration system, see if it's depleting those minerals, because we might have to add them in. A key to know if it is if you're urinating all the time. So if you drink just a few sips of water or a cup of water and you immediately need to go to the restroom, then you likely don't have enough minerals to really hydrate your cells. It's just likely going right through you. So that's something to keep in mind, is what is your water filtration system? How much are you drinking? How much are you going to the bathroom? And those can all be used as clues to see if you potentially need to add some minerals back in. Next is gut health. This one is huge. I would say this is probably half of my practice is focusing on gut health. So how often are you having a bowel movement? I always ask my patients this question. Are you going every day? Are you going multiple times a day? Or are you going every few days? What do the bowel movements look like? Are they well formed, or are they on the looser end, or more of like the pellet kind of rabbit stool end? And then are you having any symptoms of distress in your abdominal health? Are you having any gas, any bloating, any diarrhea, constipation, pain, undigested food in your stool, or an increasing number of food sensitivities where you're not able to tolerate foods that you once were able to tolerate in the past? These are all symptoms that there is something going on in the gut that needs to be addressed. So this one is also very important because we know that the gut and the hormones have a very close connection, and really the gut and everything in the body, mental health, emotional health, everything. So gut health is an important one, where if you are having these symptoms, you'll want to go in a little bit deeper with a provider to see if they can uncover what's going on and how that can be supported. Next is movement. So this one, I really wanted to emphasize joyful movement every day. So finding an activity that you enjoy doing. If you hate the gym, don't like going, feel really uncomfortable there, I mean, one could be questioning, where is that discomfort coming from? Is it because you don't know how to use the machines? And if so, would potentially getting a personal trainer or going with a friend help that? Or do you just not enjoy the activity? So if you don't like running, you don't need to force yourself to run. You can find an activity that you enjoy, whether that's dancing, tennis, sports with other people, Zumba classes, just finding a movement that you can partake in that is going to support those endorphins being produced and support that circulation in the body. So movement is really important. Aiming for at least 150 minutes a week of movement is my typical recommendation. If you can do more, then great. And try to make it, again, joyful and not something that's going to further add stress, because that is something that we have to think about, is if your cortisol levels are already through the roof and you're doing a HIIT workout for 1 hour a day, every single day, that potentially is just creating more stress in the body, and we need to balance that out with some more gentle forms of movement. So the type of movement that you're doing does matter, and this is something to, again, talk to your provider, your physician about, and see if that needs to be changed up at all. Next is hormones. So, we can't talk about preconception without talking about hormones. So are your cycles regular? Are we able to identify your fertile windows using the fertility awareness method? My last webinar that I did was all about the fertility awareness method and cycle tracking. So I'm not going to go into it too much here, but this is something to definitely be aware of, keep in mind, is do you know when you're fertile? Do you notice cervical mucus production? And can you tell where that mucus is increasing and then where it's starting to change and decrease? So that one, along with basal body tracking, potentially using LH strips, looking at cervical position or assessing cervical position, those are all things to, again, keep in mind to make sure that we are trying to conceive when we're ready on the right days of the month. These are all signs of a hormonal imbalance. And so if you're having one or many of these symptoms, this would, again, be a reason to look into this a little bit further with a provider. So we have acne on here, thinning hair or hair loss, constipation or diarrhea, deepening of the voice, difficulty sleeping, stress, weight gain, some breast tenderness, more mood changes, especially if that's happening in that luteal phase only, which is those 2 weeks before your next period. If you're noticing a lot of irritability, increased just emotions during those 2 weeks, that's something to keep in mind if that's impacting your daily life and your job and your relationships. Irregular cycles, painful cycles, really heavy cycles, or really light cycles. So if you're bleeding a lot or really not bleeding at all, those are two things that are equally concerning that you want to have assessed. Vaginal dryness, headaches, a decreased sex drive, or just no libido at all. These are all things that would indicate that we need to look a little bit deeper. Next is environmental health. So environmental health is huge. Again, I mentioned that at the beginning. The most important thing when it comes to environmental health is avoidance. So avoidance is key and is the first step. So the thing that you can do to reduce your environmental toxins, the main one when I'm thinking about this preconception time and when I'm thinking about fertility is removing endocrine disrupting chemicals from your daily life. And these are typically seen in fragrances, cleaning products, laundry detergents, so phthalates and parabens, skincare, hair care. These are all things that you want to make sure don't have fragrance and don't have phthalates or parabens in them. So if something does have the term fragrance in it, it likely has phthalates in it, and those can mimic our hormones or bind to our hormones or block our hormones. And so we want to make sure that we're not consuming or using these things that have high levels of hormone disrupting chemicals. So removing fragrances is going to be one of the easiest things to do. I mean, it might not be easy if you're really tied to a perfume, but it's something that's really important. And so looking at your skincare, at your hair care, at your cleaning products, at your laundry detergent, and really making those switches to something that is fragrance free, not just unscented, but fragrance free, does not have any fragrance in them. And then another thing would be switching glass products instead of using plastic. So switching plastic to glass. Plastics we know have BPA and other really hormone disruptive chemicals within them. And so glass tends to be a better option because you're not leaching those chemicals from the plastic into the foods that you're eating. So another area to focus on in the house, this is typically seen more in like storage containers for food and switching them from plastic to glass. Another area to keep in mind is a water filter. So filtering the contaminants that might be in our water. I have another slide coming up on the Environmental Working Group's tap water database where you can plug in your zip code and see what contaminants are present in your tap water. And then an air filter. Especially here in the valley, we don't have the best air quality. So filtering that air that we spend so much of our day breathing in is also going to be an area of focus. So this is the Environmental Working Group's Skin Deep app. This one is really nice because you can look up the products that you're using and see where that rating scale is for them. So it goes from EWG verified all the way to 10, 10 being that it's more toxic, more damaging to the environment, and then the EWG verified and 1 and 2 tend to be the better ratings. So you can look up the products that you're using here. You can look up products that you might want to consider using and make those swaps. If you want to do a whole haul of your house, you totally can, or you can do it step by step. So when you're done with something, when you go to buy something new, look up and do that research then. That tends to be a little bit easier and not as overwhelming, but I support whatever decision. This is the tap water database. And so this is for the Phoenix area because I plugged in my area code. So it looks like 8 of the contaminants exceed the Environmental Working Group's health guidelines, and there's 20 total contaminants present. The most common is typically arsenic. So when you're thinking about getting a water filter, you want to make sure that the one that you get is filtering out the contaminants that are present in your area. And again, this might depend on if you're renting, if you're buying, if you can install an under the sink filtration system or a whole house filtration system versus just using a countertop system. But it really does make a difference. You can tell definitely when you're drinking tap water versus when you're drinking some filtered water. This next area that's important is assisting detox. So this is very important. Our liver's detoxing all the time, but we can do some things to help it, and we can do some things to help clear those toxins and open our drainage pathways. So regular sweating is going to be huge. So are you able to break a sweat? Some people, it takes them a lot of work to be able to sweat, which is usually not a good sign that your body is not, easily able to detox things through the skin. Hydration. So again, are you drinking enough water? Is your urine a little bit on the clearer to more pale side, or is it really concentrated? Another thing that you can do is skin brushing. So skin brushing is going to help with that lymphatic movement and lymphatic drainage. That can help, again, to reduce our toxins and get them moving through our skin and out of our body. And then nutrition is going to be huge. We talked about that a lot already. Organic as much as you can. And then cruciferous vegetables. This is an area that I do like a lot of my women who are having cycles to be getting in some good cruciferous vegetables, because things like DIM and calcium D-glucarate are present in cruciferous vegetables, and those help our liver process any excess hormones that our body is trying to clear. So this is another area to focus on in terms of preconception care. Stress and sleep are huge. So what are you doing for self-care? Are you only exercising heavily when it comes to self-care? So that's something that I like to be mindful of when I ask patients what they do for self-care, and they say exercise, and I say, what kind of exercise? Because again, if you're only doing a HIIT exercise every single day as your self-care, that's likely not tapping your body, or it's not tapping your body into the parasympathetic state. We really want to get into that parasympathetic state of the nervous system where we're resting, where we're digesting. And this is more the baths, the meditation, the mindfulness, the gentle yoga, not necessarily the hot yoga or the power yoga, journaling, reading a book, a calming book, not necessarily a murder mystery, drinking tea, just having that nighttime routine as well. So you can incorporate the self-care into the nighttime or into the morning, but in the nighttime, it's going to help with sleep. So again, how is your sleep? Are you able to fall asleep well, stay asleep well, and wake up in the morning with energy? That is what we want. So try to stick to a routine of sleeping and waking around the same time and not extending those windows on the weekend too far. An hour here and there is okay. But if on the weekends consistently you're sleeping in 5 hours past when you normally would during the week, sometimes our body needs that, but it can just disrupt that cycle. And we want to aim for 8 hours. And then a really important thing that we can do to help our sleep that night is when we wake up in the morning is to view morning outdoor light for a few minutes. So viewing it not through a window, going out, getting your eyes in the sunlight, without glasses, without contacts, just getting some of that light in can help with setting that circadian rhythm. It can help with energy production throughout the day as well. And then our last two topics are laboratory testing and supplementation. So laboratory testing, this is the general testing that I will consider. Again, it might be more individualized, patient to patient, based on their history, based on potentially what conditions they might already be coming in with. But general testing is going to include a CBC, which is a complete blood count. This is looking at your white blood cells and your red blood cells, looking for any signs of infection or anemia. We have our metabolic panel. This is looking at blood sugar, at kidney function, electrolytes, liver function. This one, again, is really important when we're thinking about the liver and we're thinking about, is it being damaged? Is there too much alcohol or too much toxins coming in? High sensitivity CRP. This is an inflammatory marker I like to look at. The two adrenal markers I typically like to assess are cortisol in the morning and then DHEA. DHEA is the precursor to testosterone. And so this one is really important when we're thinking about adrenal health and we're thinking about testosterone production. Testosterone is another one that I want to see in a good amount in women, not too low nor too high. And then in men, typically on that higher end, because that's going to support better sperm quality and sperm rates. Prolactin, this is a hormone made from the brain that can inhibit our ovulation and can disrupt our hormonal cycles. So it's always important to look at this and make sure that this one is in normal range. And then thyroid, so TSH, that's what the brain is telling the thyroid to do. We want to make sure that that one's normal. And then the gland itself is releasing T4, so we want to check that. And T3, thyroid antibodies to make sure there's no thyroid autoimmunity happening in the background. Vitamin D is so important. This is a hormone, actually, more than just a vitamin. And this one is really important for egg quality and for sperm quality and overall immune function, bone health. Iodine is really important for fertility and for thyroid function. So I like to look at that one. I've been seeing a lot of low iodine recently in patients that I've been testing. And then ferritin is our storage form of iron. So we want to make sure that our storage form of iron is there in good amounts. And then I'll do some specific hormone testing Again, depends on the person. If they're having really regular cycles and they're not trying to conceive yet, we might not test this right up front. We might test this a little bit down the road. But cycle day 3 testing that I typically like to do is estradiol, which is the most plentiful estrogen when we're of reproductive age and not pregnant and not postmenopausal. FSH and LH, these are 2 hormones that the brain is sending to the ovaries. So I like to check in on these to look at the ratio of the 2 and make sure that they're in a range that I'd like them to be in. And then AMH. AMH is more a marker of ovarian reserve. So it's looking more at the amount of eggs present, not necessarily the quality of the eggs present. So I don't like to use this as a big defining factor when we're thinking about fertility, but it can be really helpful, especially if you're in your later 30s and we want to take a look and see what that AMH level is. And then I'll also do testing 7 days post-ovulation. This is typically looking at progesterone and estrogen and the ratio of the 2 to make sure that we're getting progesterone when it's at its highest and making sure that progesterone is increasing as we'd like it to. So this one is important, again, to consider that fertility awareness method and knowing when you're ovulating. Because if you don't know when you're ovulating, then we tend to have a little bit of guesswork here. And we don't know exactly when progesterone is going to be its highest. So we just pick cycle day 19 to 22 and hope that you are ovulating about 7 days prior to that. But if you ovulate a little later, then we might think that your progesterone levels are falsely low or typically falsely low, not falsely high. We want them to be high. And then genetic testing. So genetic testing depends again on the patient. I'll consider doing some MTHFR testing here. We know that there's an association with MTHFR mutations and recurrent miscarriages. And so if there is a family history of that, then this is something that we could consider testing to see if there is a need for more folate potentially and more of those B vitamins. And that brings us to supplementation. So in terms of supplementation, a prenatal is essential. So any of my women that are of reproductive age and are thinking about getting pregnant in the next 6 months, year, 3 months, I do typically have them start on a prenatal. Prenatals are going to have higher amounts of a lot of the nutrients that we already naturally need. But it's also going to make sure that it has a good amount of folate in it because that's very important for the baby's brain and spinal cord. And then common additions that I might consider for patients include fish oil or an omega product, probiotics, vitamin D and iron, again, depending on their levels and their history. And then additional individualized protocols would be from your provider. So if your adrenals need a little bit of assistance, there are a lot of herbs that are safe during pregnancy. And so we might start some of those. If we need to support sleep a little bit, if we need to do a whole gut protocol, then again, it is important to do that prior to getting pregnant because once you're pregnant, it does limit the amount of things that we can do in terms of different, things that we want to address in your health. So those are the main points about supplementation. I don't have any affiliation with this brand, but I do love this brand Needed. They have a lot of really good prenatals out there and good products that are safe during pregnancy. And then I think that's all. So perfect. I only went a few minutes over. I get really excited about this topic, so it's hard to reel it all in sometimes. But thank you all for listening. I hope you got some takeaways from this webinar. And if you have any questions, please feel free to reach out to me, to message me in Charm if you are a patient at Living Wellness. And if you're not, you can become one. And I look forward to meeting you. All right. Hope you all have a lovely weekend. Bye.